My topic is infectious lung diseases. First, we must know what is an infectious lung disease. An infectious lung disease is a lung infection that can be caused by a virus, bacteria, and sometimes even a fungus, in which all would affect the respiratory functions. Some examples of an infectious lung disease would be COVID-19, measles, pneumonia, influenza, and asthma, just to name a few. So, how does someone get an infectious lung disease? Well, there are only a few ways someone can get this, and it is either by infections, getting it genetically, or by smoking. An example of getting a lung disease by infection would be like getting COVID-19, and genetically, an example would be like being born with asthma. Now, some common symptoms of these infectious lung diseases would be trouble breathing, having shortness of breath, coughing up blood or mucus, and having a cough that won't go away, having pain and discomfort when breathing, and having a decreased ability to exercise and feeling like you're not getting enough air in your lungs. Some ways an infectious lung disease is diagnosed is through imaging, such as chest x-rays or a CT scan, through a spirometry, which is a tool that measures how quickly you can take in air with each breath, through pulse oximetry, which is a tool that measures oxygen in your blood, taking a sample of mucus or nasal discharge for further testing, a throat swab. Some treatments for lung infections are different depending on the type of infection. So for a bacterial or fungal infection, antibiotics would be used, and for viral infections, antibiotics would not work, which is why for a viral infection, the body would have to fight off the infection on its own. And in severe cases, when having a severe lung infection, it may be necessary to seek medical attention at a hospital. Some background on how we got to the treatments that we do today all began in the 1840s when Edwin Chadwick reported on poor living conditions when cigarette manufacturing started to begin, which caused poor air conditions, and some techniques that were used was a Hutchinson spirometer and by keeping good hygiene like hand washing. The technique that was used was an artificial pneumothorax, and a pneumothorax is used by the injection of air or a more slowly absorbed gas, such as nitrogen, into a pleural space. This technique was formerly used for collapse therapy of tuberculosis. After the 1840s, treatments continued to be developed, and in the 1850s, chloroform anesthetic was developed. And then in the 1880s, the first thoracopsy was developed. And then in the 1890s, the first chest x-ray was done, and it was also the year that a mass cigarette production occurred. Then in the 1920s until the 1990s, during this time, a bunch of treatments were discovered, especially since during this time, a discovery of cystic fibrosis gene was found, which meant that it was developed genetically, and during this time period, a lot of smoking occurred, and they discovered that smoking was a leading cause to lung cancer in the 50s. This was also during a time when they developed inhalers. And then in the 2000s, biopharmaceuticals began to be used. Going back to the examples that I gave at the beginning of some infectious lung diseases, some of the current treatments, like for asthma, would be having to use a rescue inhaler, or in severe cases, some would need steroids. For influenza, the body would fight off the infection on its own but there are anti-inflammatories that could help with discomfort or pain. And another example would be pneumonia, which would be treated by antibiotics or penicillin, or in severe cases may need hospitalization. I do in fact have some personal experience with having an infectious lung disease because I was born with asthma but was not prominent until I was about 1 year old. Because of this illness, I did have some issues with having flare-ups, meaning having asthma attacks because I was around someone who was smoking a cigarette or any sort of smoke in general, like a campfire or any sort of like wildfire. I also would have issues with getting sick almost every year. I would develop bronchitis or influenza, which would cause like a constant cough and discomfort. Most treatments that I got were either antibiotics whenever I got bronchitis or influenza. And for my asthma, I would use inhalers.